Hello.
My name's Dr. Ahmed. I'm one of the doctors here, and I'd like to start by asking some questions, if that's okay.
Yes.
Can you tell me what's brought you to clinic today?
I've been troubled with a rash, which is extremely itchy and on specific parts of my body, particularly the elbows, the knees, just in like distinct circles,
Right.
which come through blisters, which you cannot ignore, and you just have to itch them to get the tops off them to get any release. Also on the scalp and on the back.
Okay. And when did you first notice this?
This first occurred in about 2003, and I sought medical guidance on it, and was given numerous different creams to see if it would, help the condition, but it didn't.
Okay, and you've come here today because you've still got the rash and it's still a problem for you.
Yes, yes.
Did it come on gradually or suddenly?
I would say gradually, yes.
Okay. And just can you describe the rash for me? Is it red?
It comes out in distinct blisters,
Okay.
little blisters, a bit like a chicken pox blister,
Okay.
I would describe it. And in distinct circles round the elbows, round the knees, along the scalp and the back of
And you said
my
it's
body.
quite itchy as well.
Extremely itchy, unbearable itch.
Have you noticed anything that makes the rash worse?
Well, I went through a process of elimination food-wise, because also with what I was using for washing, etc. And with the process of elimination, it boiled down that it seems to be anything with the wheat products.
Okay, so you've noticed that certain foods make the rash worse and more itchy?
Definitely, yes.
Okay.
Yes, yes.
All right. Have any of the creams helped?
Some of them have helped with the itchiness, but just for a short time.
Okay.
But there's no relief until I've actually scratched the tops off the blisters.
I just want to ask you some other questions related to the rest of your health, if that's okay. Have you noticed any problems with your bowel motions or with your bowel habit?
Yes, periods of diarrhoea and abdominal pain.
Okay. Is the abdominal pain, again, related to certain foods?
Yes, definitely. Again, wheat products.
Okay. And have you noticed any other problems, such as weight loss?
I've had weight loss, yes. Lethargy, yes. Feeling extremely tired and a bit irritable.
Okay. And you said you've had some diarrhoea. Have you had any other things that you've noticed with the diarrhoea? Any blood in your motions or any black motions?
No black motions, but there has been specks of blood, yes.
And any other symptoms, any joint problems or aches in your joints?
Yes, I do have arthritis as well, and lots of achy joints, and just general feeling unwell all the time.
Have you noticed any rashes anywhere in your mouth or anything like that?
Not connected with this condition, no.
Are you taking any regular medication?
No, not at the moment.
What about illnesses? Have you been unwell in the past?
Not really, no.
Do you have any serious illnesses that you've suffered from?
No, not really.
Okay. No problems with your in terms of bowel conditions that have been diagnosed?
No.
Okay,
no.
lovely. And you said you don't have any, you have some problems with your joints. Do you have
Yes.
arthritis?
Arthritis, yes.
Okay, all right. Any family history of any illnesses?
Mother had pernicious anemia.
Okay. And have you had any problems with that condition?
No.
Okay. All right. Any problems with the glands of your body?
No.
Okay. All right, I think I've finished with asking you questions about the rash and about your condition. What I'd like to do now is examine you, if that's okay.
Yes.
All right?
Certainly. Yes.
Okay, Mrs. Thompson, I'm just going to examine you, if that's okay. Let me know if you have any pain or discomfort anywhere.
Yes.
Okay.
Right.
Can I start by having a look at your hands? And turn your hands over. Okay. You said you had a rash on your elbows at some point, so I'm just going to have a look. Nothing there at the moment. Pop your arms down for me. Just look up for me. It's fine. Can you open your mouth? And pop your tongue out. And up to the roof of your mouth. That's lovely, thank you. I'm just going to examine your back now.
Okay, you have 2 minutes remaining.
Okay, just going to have a feel of your neck. That's lovely. Okay, Mrs. Tom, thank you. I've finished examining you and asking you questions now. Before I tell you about the test that we want to do, I might explain a little bit more about this rash to you. I think this intensely itchy rash on your back that you've been describing, which is worse when you eat wheat, might be a condition called Dermatitis herpetiformis. There are treatments available, and one of them is dietary and would involve avoidance of wheat products and gluten products. Okay. The other thing that we can consider are other treatments. But in the first instance, I think we need to take some blood tests, check your blood count, check your calcium levels, do some more specialised blood tests, possibly take a sample of the skin and have a look at that under a microscope to see what the underlying cause is for this rash. Okay. Do you have any questions?
Is there any other treatment available?
Apart from the diet?
Apart from the diet?
Yes, there is another treatment available. One of them is a drug called dapsone, which is something that we can talk about because I can understand this rash is quite troublesome for you.
Very troublesome, yes.
All right.
Yes,
so we'll get the test and then I'll see you with the results.
Thank you very much.
Thank you.
Thank you.
How would you diagnose this lady's skin condition?
Okay, in the first instance, this is a lady who has Dermatitis herpetiformis, as evidenced by the very itchy vesicular papular rash that she has on her back and extensor surfaces. This condition is associated with things like celiacs, and in order to diagnose a condition fully, ideally a biopsy should be taken, which can then be looked at under direct immunofluorescence to assess for IgA deposition in the dermis. The other things that you can do is assess for a celiac screen, also perform anti-tissue transglutaminase antibodies, antigliadin antibodies, check the patient's full blood count, check to see she's not anemic, that she's not hypocalcemic, and inquire about GI symptoms in particular, because quite frequently dermatitis herpetiformis coexists with celiac disease.
Are there any other associated conditions with dermatitis herpetiformis?
The main association is that of celiac disease, and it's important to exclude this in patients. The mainstay of treatment for dermatitis herpetiformis is going to be avoidance of a gluten-rich diet, so a gluten-free diet in the main. Dapsone is also used as treatment for this skin condition, together with emollients and steroids as topical therapies. When you have a patient who has a skin condition or a rash, it's important to ask them about systemic symptoms and ascertain whether or not there are any relationships to other diseases and other conditions, such as dermatitis herpetiformis coexisting with celiac disease. There are other rashes, such as psoriatic rashes, that can be associated with arthropathy. So whenever you have a patient with a skin rash, remember not only to ask about the skin, but also about systemic symptoms, and do a full systems review.